Gary Taylor is the Assistant Chief Fire Officer for West Midlands Fire and Rescue Service. He told me how they're improving public health by going into people's homes.
Well, the fire service has realised that some of the incidents that we go to, house fires, road traffic collisions and other emergencies, even though we go to the actual emergency, the causes behind the root cause of the emergency are to do with health issues, health and well-being issues. So whilst we're trying to prevent the accidents and the injuries happening, we need to address the issues of underlying causes, really.
And how does the Safe and Well initiative actually work?
Yeah, we've realised over the last decade of visiting people's houses and fitting smoke alarms that we really need to look at, say, the causes behind the causes. So what we do is we spend the first 10-15 minutes using the trust that I have with the fire service and advising them about fire risks. And then we talk about their lifestyle, things that they need to do, specifically issues around them personally. Now that may well be something to do with mobility, it may be something to do with lifestyle. What we do is if they're prepared to discuss it with us, we can either give them advice, perhaps do things in the house to make them safer and manage the risks down, or perhaps suggest to them that we can refer them to other health partners or do a further visit with those health partners.
How effective has it been so far?
What we're finding now is that the most vulnerable people are engaged with through the fire service, and the responses that we get from the public is they really respond positively to the engagement with the fire service, rather than seeing it as impinging on their personal or private life. Because of the trust that they have in us as the fire service, they're happy to perhaps open up where other health partners or other social services wouldn't do.
How important is trust in this initiative?
Well, really, really important. I've referenced on a number of occasions a review that's been undertaken that recognises that the fire service are in the top 3 trusted public services, certainly the most trusted blue light service. But a lot of the vulnerable people become socially isolated. You know, they get a knock at the door from the police or social services or the local authority, and they won't open the door through fear of, there might be some sort of intervention. But the fire service is seen as a really positive, partner within the community. So what we try to do is just first of all make contact, build some trust, have a relationship, and then not just base it on one visit, base it on a number of repeated visits where we can start to build a relationship, build a trust, and get the vulnerable member of the community to open up to us.
And what would you like to see happen in the future with it?
We've already been recognised as a member of the wider public health workforce. We see ourselves and our relationship with health as really, really important. Fires and other emergencies are reducing, so we have more capacity to invest in the prevention and the upstream prevention. So we see ourselves aligning far more to health as a wider health asset, and establishing ourselves doing more interventions in prevention rather than emergency response, but still maintaining that capacity to respond to emergencies and house fires when they're needed in a timely manner.